We have now more than 100 persons connected. So welcome everyone. And first I would like to give the floor to Dr. Anselm Hennes, the Director of the Department of Non-Communicable Diseases and Mental Health, to give the opening remarks.
Yes, thank you so much, Leo. Good morning and welcome to all. It's indeed a pleasure and privilege to be here again. This is the launch of the program on social marketing for public health 2020. It's a privilege for me to welcome you to this webinar. Now, today, public health professionals are facing many complex challenges in their fights against non-communicable diseases, as well as coupled with the emergency response to the COVID-19 pandemic. To effectively tackle these current pressing health challenges, it is crucial to create a public health workforce which is innovative in its approaches. Social marketing is one of these innovative tools and can be defined as the application of marketing techniques to the design of programs that aim to influence behavior within a population of interest to improve its welfare and create social good. Social marketing can be used to change individual behavior. It can be used to change social norms in support of public policies or to influence decision makers. Non-communicable diseases, or NCDs, principally cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases, are the leading cause of death in the region of the Americas, responsible for approximately 80% of all mortality. NCDs can be prevented through reduction of key risk factors such as tobacco use, harmful use of alcohol, unhealthy diet, and physical inactivity. Premature deaths from NCDs can be mitigated through early disease detection and comprehensive treatment. Obesity and overweight are now occurring at epidemic levels in the region of the Americas, leading to this region having the highest prevalence of all the World Health Organization regions in this regard. The impact on children and adolescents is particularly troubling, with 33.6% overweight and 14.4% of this group being obese. The WHO Best Buys are important tools for the prevention and control of non-communicable diseases. A number of these interventions include mass media campaigns as a component, either to create public awareness or to modify behavioral risk factors. For example, guidance is provided to the implementation of community-wide public education and awareness campaigns of physical activity. That include mass media combined with other community-based education, motivational, and environmental programs. Additionally, recommendations include the implementation of effective mass media campaigns that educate the public about the harms of smoking or tobacco use and secondhand smoke, and the reduction of salt intake through behavior change communication and mass media campaigns through the Best Buys. In sum, it is necessary to raise awareness to change social norms and advocate for policy change in support of the adoption of regulatory policies. PAHO provides technical support to countries in implementing mass media campaigns, and this is to optimize the development of campaigns so that they are not established in isolation and delinked from policy actions. And this is particularly important in settings where there's limited capacity to design and implement effective campaigns. The online program for social marketing for public health was developed to build the capacity of public health professionals in developing and managing social marketing campaigns. The program on social marketing for public health is a collaboration between the Pan American Health Organization and the College of Public Health at the University of South Florida. The program is funded by the American Heart Association and the Universal Health Coverage Partnership. Together with PAHO's Virtual Campus of Public Health, the Department of Non-Communicable Diseases and Mental Health has implemented and developed several other online programs such as HEARTS, Alcohol Use, Women's Health and Pregnancy, Building Capacity for Community Engagement in Salt Consumption, Tobacco and Public Health, among others, which have all developed technical competencies among public health workers and strengthened their capacities in a cost-effective manner. The program we are launching today consists of 5 online courses offered in both English and Spanish. After the introductory course, participants can register for the next 4 courses, either with tutors or through self-learning, in which they will learn how to do formative research and develop, implement, and evaluate social marketing strategies that address the NCD risk factors. The program also includes a lesson on behavioral challenges in relation to COVID-19, really the topic of today. Today we are pleased to have with us a select group of panelists who will present on the relevance of social marketing for public health and health promotion. They'll provide an overview of the program and give practical information on how to register and participate in this excellent program, which has raised high expectations for our audience and which really has continued to deliver this very important training for several years. So again, it's a pleasure to welcome you all. You'll be treated to a veritable smorgasbord of really interesting presentations, and so I welcome you to fully participate as we listen and learn. Thank you. And I'll give the word to Leo.
Thank you very much, Dr. Hennes. So we have some panelists today. We are going to listen to Dr. Gerry Eikemans, and she is the head of the Health Promotion Unit in the Department of Family, Health, Gender and Life course. Then we will continue with the presentation by Dr. Mahmouda Pasha, and she is the assistant professor of the College of Public Health of the University of South Florida and also the associated director of the WHO Collaborating Center on Social Marketing. And furthermore, we have the presence of Carlos Leon and Gabriel Listovsky of the Virtual Campus regional team, who is helping in hosting this course. So this course is in 2 languages. Today we are launching the English version of the course, which will be available 1 hour after this webinar, and tomorrow at the same time we are launching the Spanish version. So now I would like to invite you to see a promotional video that we have prepared. So please, you can see the video.
Well, welcome to Social Marketing for Public Health. Social marketing is what I do day in and day out. I am very passionate about social marketing and I use it for my work within the field of public health. What is unique about social marketing, one of the core features of social marketing, is that it focuses on the consumer, the audience, or the population. And once it focuses on the consumer, it spends time in understanding or listening to the consumer. What we're interested in knowing is what are the desires, what are the values, what are the wants, and what are the needs of this consumer or the population that we're trying to reach. At the same time, what we're interested in knowing is more about the barriers that they encounter or the problems that they have in either accessing a service or using a product or going about changing a behavior. So once they've spent that time listening to our audience, what we do is we use that knowledge that we have gained from the research that we have conducted to develop a strategy that is tailored and adapted to fit their wants and needs. And that is the real uniqueness of what social marketing is. It's listening to the consumer and developing an intervention that responds to their needs versus the needs of our own programs or our work plans that we have at play.
In general, when we speak about non-communicable diseases, there are 4 main risk factors which are all modifiable through behavior change and through changing the environment as well. So we have physical inactivity, we have unhealthy diet, and we have use of tobacco, and we have as well the consumption of alcohol, which are important risk factors. As well, air pollution is a risk factor that affects the health of people.
Well, every year in the region of the Americas, we know that non-communicable diseases are responsible for 4 out of every 5 deaths. These include cardiovascular diseases, and it's affecting our population more than ever.
Yes, it's really important to create awareness and change behavior, especially with respect to risk factors of non-communicable diseases. We see that best buys of WHO to prevent non-communicable diseases, many have an educational or communicational component, for example, to change habits with respect to salt reduction or to increase physical activity. And we can use social marketing not only to change individual behaviors, but also to do advocacy, which is also very important, especially if we want to implement public policies.
The uniqueness of these programs are that they're designed to provide you with basic fundamental background information about social marketing, but in a very applied manner. So our goal is, in sharing the information, is that you learn not only about the social marketing process, but that you also learn about how the process is being applied to public health problems that you tackle on a day-to-day basis. So those are quite unique and interesting features of the course that we have designed for you. We invite you to participate in this course that we've developed that will help really build your skills in social marketing and strategies to really address some of the risk factors that are underlying non-communicable diseases, including healthy diets and physical activity. Here at the American Heart Association, we have a mission of being a relentless force for a world of healthier, longer lives. I hope that you will join us in our efforts. Thank you.
Thank you very much. This is really a joint effort between different departments and with our collaborating center, and also we are very grateful for the support of the American Heart Association and the Partnership for Universal Healthcare. So we will now start with our panel. So if people want to make a public comment, they can do so in the chat, talking to all participants. And if they have a question, they can ask the question in the question and answer chat, and we will later take all those questions because at the end of the 3 panelists, we will have the option for some questions and answers and a small debate. So having that said, I would like to give the word to Gerry Eijkemans. He is the Chief of the Health Promotion and Social Determinants of Health Unit, and she will speak about health promotion and why it is important to achieve behavioral change with social marketing tools. So please, Gerry, you have the floor.
Thank you so much, Leo, colleagues. Real pleasure to be here with you. Thank you, Leo. A long time ago, somebody pronounced my name correctly, so I'm going to say Leo Nederveen. Thank you. And dear colleagues, first of all, congratulations. I think you did an absolutely fantastic job on this program, on these courses that you developed. Very, very timely, very important. I'm going to make a bit of a reference to COVID later on because I think it's not going to be only important for NCDs, but also for a much wider range of issues. Next one, please. So I'm going to speak a bit about health promotion and how social marketing enters there as an element, an essential element, but as an element of a wider policy and program setting framework. You know, when we talk about health promotion, we usually go back to Ottawa. No, it's a few decades ago, but still, when the Ottawa Charter was made, it defined health promotion as the process to enable people to increase control over their determinants of health and, in consequence, improving them. And it also talked about that it constitutes a global political and social process that includes actions that strengthen the abilities and capacities of individuals and communities. Very, very closely related, of course, to what we are talking about today. And also, the process includes actions that modify the social, environmental, economic conditions with the purpose to mitigate the impact on individual and public health. And we're always saying, make the healthy choice the easy choice. And that's basically what this second part is about, but giving people the right information, understanding what they need, as we heard in the video, but also make it possible, make it attractive for people to implement, to apply what they learn or what they receive through social marketing. And another element that has been essential in the process of health promotion is participation of the community, also of civil society, also of private sector. That's really important to sustain actions in health promotion. Next one, please. So we are not going to make our own health promotion process in the Americas, but we have had a whole 2 years of consultations, work with countries to look at what does health promotion look like in our region, taking, of course, all the global mandates like the one I just mentioned on Ottawa, but also a much more recent one on Shanghai, etc. But so that we looked at what is important in our region. And first of all, we said, the approach is really to build health, not one to repair diseases. We all know when somebody comes down with a chronic disease, with a non-communicable disease, the cure, of course, is possible, but it's much more difficult than intervening early on in the process. And it's really about working with the assets of the communities, with the strengths of the people to build that health. It is an approach that's based on rights, on equity, and on social justice. It builds on intersectorial work, and it addresses those determinants of health, the underlying factors that determine how we live, work, consume, etc. It is a political process. It's a social process. So within that, there are many elements. And we also see health promotion in this region not as a discipline or something that stands alone. And this is, of course, the same, we talk about social marketing, but really as a pillar, something, that is a pillar and an essential element for all public health policies. And when we do look at health promotion and we look at going beyond the repair of disease, really this paradigm shift that we would like to see, we do know that it requires deep changes, and it requires brave governments, and it requires very strong public health officials like yourself who can make that shift. Next one, please. So within that context, we developed the strategy and plan of action on health promotion within the context of the SDGs. That was that process that I was talking about with all countries of the region. And the objective there is that was approved last year in the Directing Council by all the Ministers of Health. The objective is to renew health promotion through social, political, and technical actions addressing the social determinants of health, to improve health and to reduce health inequities within the framework of the Sustainable Development Agenda. And as you can see, there are 4 lines of action on the right. It talks about settings, it talks about the participation of the community and empowerment of civil society. It talks about enhancing good governance, intersectorial work to improve health and well-being, and it talks about strengthening health systems and services by incorporating a health promotion approach. Now, this doesn't talk specifically about social marketing, but none of those areas are possible without it. And I think when you read the strategy, when you go look at it, it's very, very clearly outlined there. But what is important, and I will get into that in the next slide, that we don't see social marketing or health literacy or educating people on their health as something in isolation, but really as the bigger process that I'm describing here. And of course, the actions need to happen, and I think very clearly comes out of what we've been hearing at the local level, you know, in the people, with the people, in the families, in the communities, at the municipal level, at subnational level, and at national level. There's space for all those activities and for social marketing at all those levels. Next one, please. So, and this is the part, this is one of the images we use to show that if you look at an iceberg, and this holds for NCDs, but it also holds very, very much for what we're seeing now with COVID, you know, that the lifestyle and the risk factors are just the tip of the iceberg. And what is under that has to do with those daily living conditions, housing, employment, social support, the safety situation in the country and in the community, etc. And also with these economic and social structures that we have been talking about. How are the power divided, wealth is distributed? What are the fiscal policies that Ansel also spoke about? How does class and gender influence what we do and how we live? So all those elements are important when we talk also about social marketing. And again, I think this shows very much that it's part of a bigger picture, and that just focusing on lifestyle and on you know, having people having all the elements to know what to do is very important, but it sits on a very big base of other elements. Next one, please. And this also holds for the individual level, you know, what goes into health. I personally like this one, although we work very little from a health promotion perspective at the individual level. But if you look at it, we say, okay, 20% is healthcare. You know, that's where we put 90% of our health money goes into a health system, you know, and our services in repairing health. And then you see about 30% comes from healthy behavior, which is very significant. It's really, you know, as you see, and this, I mean, you can play with this, that these are not absolute numbers, but these are estimates from different parts of the world, and they come out pretty consistently in different studies. Then the physical environment, like housing, etc., is about 10%. And then the socioeconomic factors that I talked about, education, job status, family support, income. Income is very important. You know, we know that our gradient in terms of life expectancy and in terms of healthy life expectancy is really very strongly associated with our income and our socioeconomic status. So all this is part of that logic. Next one, please. So within health promotion, we have been talking about, you know, health literacy, and this came very strongly out of the last health promotion global conference in Shanghai, where we defined health literacy as broadly to the ability of individuals to gain access to, understand, and use information in ways which promotes and maintains good health for themselves, their families, and their community. Obviously, totally linked to, and the tools for that are the social marketing that we're talking about today. And it also talks about empowering citizens. You know, so improving the health literacy in populations provide these foundations on which citizens are enabled to play an active role in improve their own health, engage successfully with community action for health, and push governments to meet their responsibilities in addressing health and health equity. And I think this is another important element of the social marketing we're talking about. You know, that people understand what's good for them or what's not good for them, and how what is needed from the government to really make that healthy choice. Next one, please. I'm almost coming at the end. So the health promotion takes that behavioral change model, which is in a preventive approach that focuses on those lifestyle behaviors that impact health, and it seeks to persuade individuals to adapt this healthy lifestyle behaviors, to use preventive health services, and to take responsibility for their own health. Again, part of the bigger picture that we mentioned earlier. Next one, please. So put together health promotion and social marketing. Here they're next to each other, but I think they overlap. You know, they're basically they have very similar objectives. They use different or complementary strategies. So when you look at health promotion, it really looks at the health inequalities, looks at empowerment and social determinants of health. It seeks to change the system using strong participatory approaches. And complementary to that, the strength of social marketing for health are this particular approach to achieve and sustain behavioral goals by understanding the target audiences and making it easier for them to adopt those behaviors that are life enhancing. And I think our previous colleague said it much nicer than me, so I'm not going to delve into that much more. Next one, please. So this is my last slide, and I want to do a little bit of reflection here. So when we want to see behavioral change, this is a collective challenge. It needs many different approaches, and I just put a couple out there here. Primary healthcare, very much linked to this. Our health professionals have to be able to understand what creates health, what people need to know, and give that message, pass that message on. Of course, there is the mass campaigns, but there's also this individual one-to-one discussions that physicians and nurses have with their patients, extremely important in this context. Universal health, I don't need to say more. I think this is one of the overarching objectives we have collectively in public health, addressing those social determinants of health that we're talking about, using a health promotion approach, and using social marketing as one of the very important tools. And to be successful, it does need to take into account the efforts of the population's knowledge, their understanding of their needs, and their capacity to build together with governments, with private sector, with civil society, etc., those solutions that we are looking for. Now, this is now needed more than ever. And just very briefly, if you look at COVID, we have had very, very strong messages, particularly within the emergency response. We're talking about risk communication. People understand, or at least get the message of where the risks are. But then when we look at countries particularly in South America, where when we say stay at home, don't go out, keep your kids safe at home, those messages only have an impact if people really have the conditions to do that. So if we are saying stay at home and you have to go out because you're an informal worker and a mother of 3 or 5 children who you need to feed, then you can have the perfect message. You have all the information, but if the conditions are not there to support you, it's very difficult to comply. So I think, but at the other hand, I think the adaptation of those messages to people is so important. And again, there is where I think that social marketing is extremely important to accompany those very broad messages. Wash your hands. Yeah, that's all very nice and well if you have running water at home. But if you don't have, now what are those alternative messages and how can we also use social marketing for that? So I think the timeliness of this is absolutely spot on, and this is absolutely needed, what we're doing and what you're showing there, to not leaving anybody behind to accomplish this 2030 agenda for everybody. Thank you very much. Congratulations on a great job, and thanks for having me here to participate with you in this. Thank you.
Thank you very much, Gerry. I think this was a very clear overview of where stands social marketing, how it relates to health promotion and social determinants of health. Yes, it's true that it can be applied very good to the risk factors, but it also applies to other behavioral factors, not only risk factors of NCDs, but people will learn in this course the methodology to how to set up a good social marketing campaign, and it can also help somehow to support public policies to address wider determinants by creating social norms and advocacy. So we can now go ahead with Dr. Mahmouda Pasha, and she is the Associate Director of the WHO Collaborating Center on Social Marketing. And well, she will explain a little bit more what social marketing is, and she will give an overview of the program of the program on social marketing. So please, Mahmouda, you have the floor.
Well, thank you very much for the introduction. Well, good afternoon and welcome. The focus of my presentation, as has been shared, is going to briefly introduce you to the social marketing and also share with you the structure of these series of courses that we are launching this afternoon. I'm excited to share this information with you and welcome any comments or concerns that you may have. Next slide. Just by way of introduction, so as mentioned, my name is Mahmouda Khalik Pasha, and I'm an assistant professor in the College of Public Health at the University of South Florida, and also the associate director for the WHO Collaborating Center on Social Marketing and Social Change. Working alongside me and a vital member of this team is Sylvia Samariva, who's a doctoral candidate in the College of Public Health at the University of South Florida, and she, along with the others, were fundamental components of this course that we're going to be launching this afternoon. Next slide. So social marketing at the University of South Florida has a long history. USF has been at the forefront of social marketing research applied to public health for decades. Based on this work, we were recognized as a WHO Collaborating Center in 2014 and redesignated as a center in 2018. To date, we have collaborated with WHO and PAHO on several projects investigating the use of social marketing to address non-communicable diseases, and most importantly, in building capacity and providing technical assistance on the use of social marketing. As I look at some of the attendees that we have, I see some of the individuals who have been partners in this effort to get to where we are today. Next slide. The WHO Collaborating Center, our mission is to address the growing problem with non-communicable diseases by capitalizing on the strengths of social marketing coupled with social change strategies. Our activities are focused around 3 pillars. Those are of training, technical assistance, capacity building, and knowledge exchange. Next slide. So we have a long history of working with PAHO and utilizing virtual platforms to educate the public health workforce. The development of these courses on social marketing is built on these previous collaborations that we've had, the lessons learned, as well as the products that we've developed and disseminated. So what you will see in these courses is just not didactic information about social marketing, but you will get more practical and applied information that you can adapt and apply and use for your daily work. Next slide. So as mentioned at the beginning, public health professionals are facing increasingly complex challenges in their fight against both communicable and non-communicable diseases, as well as an emergency response as we see with COVID. To tackle these problems effectively, it is crucial to create a public health workforce that is able to tap into a wide range of approaches, social marketing being one of them. While you will learn more about social marketing and its distinctive features and how it has been used, I wanted to take this chance just to give you a brief introduction, just in one slide, to what is social marketing and what makes it unique. Social marketing, the definition of social marketing, is that social marketing seeks to develop and integrate marketing concepts with other approaches to influence behaviors that benefit individuals and communities for the greater social good. Our goal is to use marketing tools to promote sustainable and positive social change. We accomplish this by human-centered, user-centric, or focusing on the consumer and understanding their motivation and their barriers and developing a product that is responsive to their needs. We use research to get these insights and use marketing techniques to develop interventions that help to change behavior, increase access to a service, or promote the use of a new product. In the end, we strive to achieve social good. Next slide. So to build capacity of the use of social marketing to promote public health, PAHO is implementing these introductory series of courses on the basics of this discipline titled Social Marketing for Public Health. In this course, you will learn how to use social marketing to improve public health in such diverse areas as breastfeeding, healthy eating, and heart disease prevention. Along with this, you will get a chance to discover how social marketing can apply to your field of interest. Launching this afternoon with the first course, the course is for public health professionals and advocates such as you interested in promoting healthy behavior change. This includes researchers, and practitioners working within their field to promote change at both the policy and individual level, as well as community engaged efforts. Next slide. The curriculum is comprised of 5 courses, each with 4 to 8 lessons that are interactive, practical, and based on the experience of social marketers from around the globe. Course 1 introduces you to social marketing and shows you how the powerful discipline in action through illustrative case studies on such diverse topics as breastfeeding to cardiovascular disease. Course 2 focuses on the initial planning efforts for social marketing. So it focuses on how you go about selecting a behavior, selecting an audience or a target population, and then also planning for the formative research. Course 3 focuses on how do you translate the research findings that you have gathered into developing a social marketing and communications plan. Course 4 focuses on the program development and management and the implementation. And finally, course 5 focuses on the importance of monitoring and evaluation. Course 1 is for everyone, and course 2 to 5 are for those that are interested in applying social marketing to their work. We have 2 tracks for course 2 to 5, with one that is self-paced and learner-initiated, and the second that allows you to work with a social marketer who will provide you technical assistance as it relates to your work. Next slide. We look forward to welcoming you to this course and learning along with you. If you have any questions regarding the work or would like to work directly with us to apply social marketing, we would welcome the chance. I will be happy to take any questions related to the course and our ongoing work. Thank you.
Thank you very much, Mahmouda. This is an ongoing collaboration. We started working together on self-reduction, especially on in a project with IDRC, which was looking at the reduction of salt added during cooking or at the table, and now we have broadened this effort to all risk factors and really how to learn to manage a program on social marketing of public health. So I think this is a very successful collaboration we are having. So please, I would like to request the participants all questions they have, if they can put them in the question and answer chat. And we will now go on with our next presentation, which will have a very practical character, because 1 hour after this webinar, the course will be open for everyone. So they will explain what works and how to register all other practical aspects. So please, we have with us Carlos Leon and Gabriel Listovsky from the Virtual Campus of Public Health. So they will explain us everything about this course.
Thanks, Leo. Good morning to everybody. Sorry, because I can't open my camera today in this computer. I am very happy to be here today. A lot of work. Thanks for inviting to participate. Especially, I want to congratulate all the team, Leo, Maria, Alejandra from Non-Communicable Disease, and to Edgardo, Carlos from the Virtual Campus team about all of this work, to Alejandra Avila too. I am very happy about this project. Without a doubt, this program will have a prominent place in the Virtual Campus training offer. I am also glad to see that this version in English may be especially used by colleagues from our Caribbean countries. It's important to say that in the last 4 years, we have been growing a lot with our offer of courses in the English countries of our America, and we hope to have a large number of users taking advantage of this course. The next, I don't know, I can do this. Okay. This is the site of the Virtual Campus. All of you are invited to visit the Virtual Campus and to enroll. You can see up in the right, you can see how you can enroll in the Virtual Campus. is the same as today we do in different platforms that we work. We have different kind of courses and materials, self-learning courses and courses with tutoring. This social marketing program begins with self-learning course, but after this you have from the number 2 and to the number 4 different courses with tutors that you can work with this. This year, I want to share with you that this year we have already reached more than 1 million of users and 1,700,000 enrolled in different courses in the campus. And I am very happy that you will be part of this. I am going to do another. I invite in the next hour, the course will be open and you can enroll and enter to the English version of the course, yes? Here is the course in our self-learning area. In 1 hour, you can visit and the course will be disponible and open to you. And finally, the next, I am going to the next. All of the participants that complete all the activities of the course, all the activities of the quizzes, etc., can download their own certificate similar to this with the sign of PAHO director, yes? And of course, we are open to help all of you if you have any problem to enter to the campus, to visit the course. Our help desk is open to receive your questions and help to work with the course. Thanks and good job with the course. Congratulations to the team and good job. And thanks, Carlos Leon, about the work with this project. Leo, I give the floor to you and thanks.
Thank you very much. So we can now have our question and answer session. So yes, we are very grateful for this collaboration as well with the virtual campus. And actually, we see that this is a very cost-effective way for learning. And especially in these times of COVID, there is no alternative either, but also it's a very good way to reach a lot of people without having to travel, and workshops, training workshops are often very expensive, and these courses will be online for 2 years' time and free for everyone to do. So I have a few questions already in the chat. There is a question from Gail Thomas for Gerry. He says, I can relate to what you said about crafting perfect messages, but having to do it in the context of situations where people may not have the capacity to act on the call to action. Wash your hands. I don't know if you would like to specify a little bit more what your question is, Gail Thomas, and then we can open your microphone. Manuela or Maria Alejandra, if you can help giving the floor to Gail Thomas.
Yes, I have unmuted the microphone.
Hi, good morning.
Yes, please.
Yes, so my question was that, so I'm in Trinidad and Tobago, and we're executing a communications campaign. And one initiative that we have planned is to deliver COVID-19 health messages in rural areas. And that very question that Dr., forgive me the pronunciation, Ekman spoke about having to go there and tell people, well, wash your hands, social distance, you know, it's difficult because in some of those areas they really may not be able to do that because of how they live, where they live, if they even have access to water. And so I am sort of challenged in terms of how to actually, what do I say to people? What do I say to them in that circumstance? You know, so we're delivering this message via tongue crier, right? Going around the speaker, and I'm trying to craft the message, and I'm challenged doing it for that very same reason. How do we say it? You know, the messages could be as well crafted as could be, but people simply are unable to do it. So I was just wondering if you have examples that you can share about in situations like that, how you treat with that kind of message.
Thank you. Well, I'll say something about this, and I'd also like to hear my my colleagues to see what they say from a social marketing perspective. But we have been focusing mainly on, as you say, adjusting the message to the realities. But it's not always that simple, you know. You will have to do something also on the supply side. You know, if there's no water and there's no soap and you have no money for sanitizers, the message becomes extremely complex. And so there are some materials that were developed by PAHO on alternatives for hand washing. And so you will be able to see them, which are, you know, they're not ideal, but it is better than not doing anything. Yeah. So, but I encourage you to look at that. At the same time, PAHO has developed and is giving guidance on how then to make sure that even if it's temporarily, water is brought to those communities and what is needed to do that. So, and that again shows that communication and social marketing, etc., goes hand in hand with that other side, which really makes it possible for people to follow the recommendations that we are giving. But I very much would like to hear from Mahmouda now to see what her take is on this, or Leo. Over.
Yes, I think Mahmouda possibly could complement.
Yes. Yes, no, I agree with exactly what you just have shared. Because the messages will not be effective if you have all these environmental barriers that exist, and then also the barrier of do they actually understand what the message is communicating, because it may be a concept that they're not familiar with. And so for the course that we're speaking about today, one of the aspects that we do talk about is that using some sort of research that you may do. So you may have access to research that may have been conducted in this particular population related to some other area, and you can maybe take some information from that and apply it. Or it is actually going out there and speaking with them, or using virtual or some form. But we have to basically understand where they're coming from before we can tailor or adapt that message. And then definitely, if there is no supplies that are available, we have to do something. One of the things that we talk about in social marketing is the aspect of journey mapping or participant observation, which is a research technique, which is you go to where the community is and you observe what they're doing. Because maybe the community has some local or context specific or things that they already do that go towards, say, washing hands or doing that same, and they're using local things that are available to them. So by spending some of that time or speaking with some of the key players, you get that information, so that way that message that you have hand washing, you tailor it to fit where they're at, and then that makes the message far more effective than if you just go in and say something that applies to everybody without taking into consideration what's going on. I wish I could help you a little bit more, because in the context of this emergency, it's just very difficult because we have so many our own barriers as program planners. But those are some of the steps that we recommend and that we give some key points towards in the courses that we have developed.
Okay, thank you. That was very helpful. Thank you.
Thank you very much. There are some questions related to the course duration and when do we start with the courses, and some are being answered in the chat already, but anyhow, maybe it would be good, Mahmouda, if you could give a little bit more detail on what we expect from the participants. What I can say anyway, that 1 hour after this webinar, the English course will be open for participation. And there at the end of the course, there will be a registration form for the next 4 courses. We have course 2 also already ready, but from course 2, there will be like 2 streams. One stream will have a tutor, and with that group, we really want to have people who are in a position and in the ability to implement the social marketing campaigns as well. And we know that with the funds of the Universal Health Coverage Partnership in some Caribbean countries, there are some plans and initiatives to develop and implement actually a social marketing campaign. And there is another stream which is open for everyone to continue on a self-paced manner. So maybe Mahmouda, you can summarize a little bit this practical questions on duration and what is expected from the participants.
What I would share is that course 1 is just more of an introduction. It just gives you an understanding of how social marketing has been applied to diverse topics, and so kind of showing you it in action. That course shouldn't take that long. It could be up to 3 hours in terms of just going through the various case studies. And you could just pick the case study that you're particularly interested in, so that wouldn't take that much time. Course 2 to 5, if you are going through the course and working on it at your own pace, as well as working with a tutor, I would say it may involve from 1 to 3 hours of time per week that you may be dedicating to this work during the time period that you're taking the course. Because there's a time that's involved in reviewing the lecture and some of the readings that may be there, but then most of the lectures from course 2 onwards have an actual practical or applied component. So you learn what's there, and then you have to spend the time applying it. And if you're doing it in the tutoring stream, then you will want to set aside time to meet with the tutor so that they can review the information, provide you feedback, and help you improve upon it. So I would say that would be where I would say generally what you can look at. However, when you enter the formative research phase and the development of the campaign itself, the formative research I really can't define, because you could spend the time developing the instruments, coming up with the strategy or the protocol, but then the formative research itself could take time depending on the audience, the resources that you have, the rigor of what you want to do. And so that depends on you. But the courses themselves still would just take 1 to 3 hours of your time. But, you know, as you get the data, it takes time for you to review the data. And once you review the data, then it's translating it into a strategy. So there's more time that will have to happen on the outside. But the course itself just should be 1 to 3 hours, I would say, per week that you may have to set aside just to review the course-related materials and following up with a tutor if that is necessary.
Thank you, Madam. There's another question for you. If gender and diversity issues are included in the social marketing curriculum?
I would say we haven't directly addressed gender or equality issues. However, because our focus for social marketing is listening to the consumer or listening to who your audience is, so in that respect, we're thinking about that. So we're not developing these one-size-fits-all strategies or interventions. It is about really tailoring what you come up with and conducting the research or listening to your target audience and getting their feedback, and then using that to develop the initiative. And so in that respect, if you do it well, or if you spend the time, then you will be addressing some issues related to gender as well as equality-related issues, because you're making sure you're accounting for those in terms of any intervention that you're developing, because your audience will communicate to you what their motivations are, what their drivers are, what their barriers are, how they want to receive the information, where do they want to receive the information, and what do they recommend. So you will be able to tailor whatever you come up with based on the requirements that the user has. So in that respect, I would say we are addressing those aspects from a very practical, applied perspective by the focus on listening to the consumer and developing something that applies to who they are and where they are and what they actually need at that moment.
Okay, thank you very much. We have a few persons who have raised their hand earlier on. So we have Paula. Maybe we can give her the floor, Maria Alejandra. If you could give the floor to Paula, please, so she can ask her question or make her comments. And we have also Marcia Munnings. Okay, I see that Marcia.
Yes, Marcia, go ahead.
Marcia, you are unmute now. Please unmute yourself. Yes, you can talk now.
The exchange for the overview of all of the presenters was very interesting. I'm in Nassau, Bahamas. I'm with Ministry of Health, and my concern really is about access to services as it relates to mental health and diabetes as we strive to build capacity in social marketing in this new era.
Yes, who of the panelists would make a comment about it? This is of course a very big concern. I think we cannot only address this through social marketing for public health, but of course it's a very important concern. Yes, maybe we can come back to this later, but yes, social marketing is really to change behavior. Of course, we can tailor some messages that could help self-care of patients. I don't know, Mahmouda, if you have also some thoughts on this with respect to use of health services.
I think as I mentioned to you, for social marketing, it's not just necessarily about the behavior. It's also related to access of services as well. And then also the use of any new products that you may have. And so what it goes down to is, the initial phases is really trying to understand, well, what is really preventing the participant or the individual from accessing those services? And maybe you come to where there's a lack of services or there's not coordination for those services. And so one of the other things I wanted to mention is that we don't always think downstream in terms of what do we have to do necessarily at the individual level, because what it could mean is that something is not happening at the policy level or the environmental level. So you can use social marketing to apply at that level too, in the sense of your target audience becomes policymakers or the decision makers or other stakeholders, and your campaign the program that you develop is more targeted at them to make sure that the changes happen upstream or midstream, so that way then it translates down to the end user or the individual that you have to. So that's another way I would say, you can look at it as well, is that we're not necessarily only focused on just individuals. We're also looking at the larger system as well, and there's a lot of different players. And you can use social marketing as a tool or a framework to guide how you go about addressing, issues at, say, upstream, midstream, and downstream. So that's how I can respond to this particular issue from just some of the work that we've done previously in terms of how we've gone about targeting. I worked on a project where we worked on adolescent obesity. And so adolescent obesity, we focus on institutional policy change within schools and within specific municipalities. And so making sure that there's policy level change there before we can actually go and talk to the individuals. And then, the project that we've been working on with Latin America, as well as in the Caribbean, focused on hypertension and salt reduction. And our focus at that period of time was focused more downstream at the individual level. But we did that because other actors that we were working with were focusing more upstream with reformulation and other aspects. So, that's how I would kind of respond to your query, that, it's just not only about just individuals, but also looking more upstream as well.
Thank you, Pascal.
Thank you very much for this declaration. So we also have a question here, which comes from Ayana John. She says, sometimes the communication team may not see their role in the behavior change process. Does the course address the role of the communication team in the actual provision of the means to achieve the desired behavior? So I think she is referring possibly to communication specialists who do institutional communication, and this is more related to behavior change communication. If I understand well the question, so yeah, I think that's again a question for you, Mahmouda.
I think that's a terrific question, and in our course 3, that is one of the areas that we, we speak about. It's about that once you as a researcher or you as a practitioner have gone about planning for your social marketing, intervention and have conducted the research, how do you translate the research into an actual strategy? So it's a social marketing plan with the communications elements that would be. And so one of the things that we have had, we have been successful in, is that we talk about incorporating multiple members on your team. So you not only do you have people from different segments, but you engage the communication specialist or the marketing specialist early on, or you're aware that they're going to be, so that they're involved with you every step of the way. And so that way, when you get to the point where you have to translate the research findings into developing a communication strategy, they have been there with you all along and are on board in some respects, and then they can build off, they can use their strengths, which is in developing the messages as well as the visuals, and also understanding like how do you communicate what you found in research, or how you communicate the insights that you have into actually developing into messages. So we actually advocate for the incorporation of that, and in course 3, we talk about kind of the formulation of this team. How do you kind of work together? How you develop a creative brief? How does the creative brief go into the development of the strategy? So that we address elements of that in course 3 once you get to that point.
Thank you very much. So there are a few other more practical questions. People are asking if they can work in groups or individually. So I think the first course is really self-paced, so it's individual. But then from course 2, there will be this option to work with a tutor, and there we plan to work in small groups. So if in some country there are some funds available to do a social marketing campaign, then we really would like to see that a few people from that same Ministry of Health or institution are together in a group. It's also there's also a question who will be considered to be in the stream with tutors and to be in a stream without tutors. So actually our target audience for this group are people in ministries of health who really work in a health promotion unit or in nutrition or in the prevention of NCD risk factors. So our priority are the people who are actually have the option to apply. We try to have as many as groups of tutors that are possible. Of course, requisite is to have completed successfully course 1, and then we will have to see a selection also related to the funds we have available and the amount of tutors. But yeah, that would be the answer. Then we also have a question related to the cost of social marketing campaigns. So yes, that's again, I don't know, maybe if you, Gerry, could mention something about that, because I think you also are receiving a lot of requests to do some educational activities. We in our course are planning to have some scenarios. Well, if you have a lot of money, you can do a full-fledged social marketing campaign. If you have less money, at least make sure that the quality is okay, following all the steps. And as we have seen, the consumer approach and the formative research is really important. I don't know, Gerry, if you would like to comment on this.
Thank you, Leo. I do not have specific information about cost. I think it's very much what you said. It really depends on how big if you want really a mass campaign involving different actors, TV spots, etc. I mean, that's one thing. But the other thing, and that's what you're seeing again now, bringing it back to COVID, is basically the integration of the messages in our daily work and our daily life, and adjusting them to the local realities. I think one of the basic and the most important things, and that's come out of this this webinar, has to do with whatever you do, make sure that it is with the community, that you understand the local context, that you understand the conditions in which people live and what they can do with that information. And I think that doesn't really talk about, how much it's going to cost, but that is something that will need to be like an integral part of the work of healthcare workers, not only of our communicators, of our communication teams, which of course is very important, but also of the people who deal, on a day-to-day basis with the communities, because they know what the local realities are, etc. So there, I don't think we are really looking at a whole lot of costs. It's really about a change in how we understand and communication, and that is not a one-way street, and then it's not the expert to the person, and it's not just telling people what to do. And I think that's becoming very clear, and that's also why I think the course is so important at this point to take that into account. Thank you.
Any additional comments, Mahmouda? You are muted, Mahmouda.
Yeah, sorry. I agree with what was just said. It just really depends on how what your focus is. If it's like a small community, and you could be just one individual who could do it, but it's larger. So it's it's specific to what you're doing and the reach of your initiative, and that really determines the cost that will be associated with it.
Okay, thank you very much. There's also a question from Erin Brown. She is Disability Inclusion Consultant in the Bahamas, and she is asking, how do we emphasize accessible and inclusive communications, especially in social marketing, for our community with disabilities? Could you answer that question, Mahmouda?
That's a very good question. I actually have a doctoral student who's just her second year of study, and this is that area that she's very passionate about in terms of how social marketing could be used within the disability sector, and from the perspective of developing interventions, because that's she's working on a paper that should be coming out, but we looked at how social marketing has historically been used and any literature, and there's a huge gap on that perspective. The main thing is that I can just speak back to is that if your target population is going to be the population who comes with either a physical or mental disability, then you're speaking to that population and you're asking them, hey, if we want you to be more physically active, how do we go about communicating that to you? What do you need? How should it be structured? What should it be saying? How often should, so the population that you have is really the one that is, again, driving it. And so in that respect, that's the way we could go about, including it. I will say this field itself, as I mentioned, is very much in its infancy at the moment. And so I'm going to learn along with my doctoral student in the next couple of years as she starts delving into this topic in terms of how do we go more in from an academic perspective within this field to make sure that social marketing is used more so than just from a medical model in terms of everything being done from a very medical perspective, not really looking at the social environment in terms of where people live and work and play, and addressing components coming from that perspective.
Okay, thank you. There's another question. How will this course assist me in dealing with patients who may have fear about breastfeeding their infant in the context of COVID-19? So I think that this is really important as well. Breastfeeding is one of the topics in course one. We have a case study on breastfeeding, and we also have a special module on COVID-19 because a lot of questions were raised, and this is one of the important things. So we have on our website of PAHO actually information on how to deal with breastfeeding in the case of COVID, and those fears are really not justified. The advantages of breastfeeding are much bigger than any potential risk for infection. So please have a look at our website, and you can write us as well if you would like to have further information. Not sure, Mahmouda, if you would like to complement something.
I think
And Harry also. Yeah.
Harry, do you want to? No, I was going to just say what you said, Leo. That would be a starting point. Yes.
Then Harry, please.
Yeah.
Yes, thank you. I think this is a very important question to the point of fear. You know, things are not always rational, and I think this is also extremely important when we communicate. That for us, when we have the information, it seems pretty straightforward. You know, that the evidence says that there is no risk. But you know, there is so much uncertainty and things have changed, and so it's also very important to understand where people come from, what their beliefs are, what their cultural norms are, and take them into account when you make the message. And as I said, it's just not enough to give the information and the evidence. Everything we say has to be based on evidence, but it's not enough to just give the facts, because there are too many elements that influence people's behavior that go beyond that. So I think this is an extremely important point. And again, it goes back to the use of social marketing and the understanding of what drives people and why people do things. And how we communicate. So risk communication again is extremely relevant there. Over.
Thank you very much. So I have also someone who is wondering how to create social marketing plans during this pandemic, when it's difficult to conduct research and map a journey or speak with target populations to design social marketing campaign to address the spread of the virus. Yes, that's totally true. But yeah, the course, of course, and the program helps to build capacity on developing social marketing campaign, and especially in the groups that have the tutors. They will guide you through the whole development phase, and we hope, of course, that when the implementation starts, we are living in a much better world in that sense, that we won't be affected by this virus in the way we are currently. So Mahmouda, maybe you would like to add something to that response.
I would just say two things. One is the course that opens this afternoon, you can watch the COVID module, where it provides kind of practical ways of how social marketing has been used currently in terms of the approach that it has had. And then the second thing I wanted to mention is that we have one of the journals for our field is Social Marketing Quarterly. And right now there is a publication that just came out. I think it's online right now, not in print yet, but it's about, from Nancy Lee on Social Marketing Quarterly on like how social marketing can apply in this to the COVID pandemic. And so I would just recommend those as two initial places for you to go to really understand how social marketers are discussing this or talking about it. And then the second is, once you have that basis, then going forward and just going through the courses to understand how you can actually apply it to your specific setting.
Thank you very much. I don't see any more questions, and we are coming to the end of our time. So I would like to ask all panelists to make an additional comment. So first, Gerry, would you like to make a last comment?
Well, I think, as I said earlier, this is an extremely timely launch, very important. I do think that, we have two huge public health challenges at the moment. It's, of course, COVID, which dominates and which has also given this not only public health, but also social, economic, even political crisis that's happening very, very clearly on the forefront. But that does not actually remove the other huge pandemic we have, particularly in our region, that's related to NCDs. And actually, we also see that COVID also increases the risks for people with pre-existing conditions, but also intensifies the mental health problems and the through unhealthy lifestyle, etc., being at home, the physical chronic disease problems. So I think there's a lot of interlinkage here where we do need to have that very intelligent, very precise messaging with strategies that go beyond just, common sense. This is a science. This is something you can learn, and this is something you need to apply if you want to be effective in communicating. And maybe in linking it back to the last comment, I think COVID shows us that the world is not ideal and that we cannot always test everything and try it out. I think we're really learning here to improvise and to work with the new evidence that becomes available, and also with the changing environments. When I think about the Caribbean and COVID, I think we have had a time of relative peace when islands could basically isolate and control COVID, but there will be times now when you start to open for tourism, which is essential as a lifeline, where you will find a totally different environment, where you need different messages, where you need a very, very intelligent approach in order to have the collaboration of everybody in order to get through this safely. So again, very timely, very appropriate for different aspects of public health. And thank you very much for the opportunity, and good luck everybody with the course. Thank you.
Thank you very much, Gerry. So Mahmouda, some final comments?
Yes, I wanted to just say, thank you for kind of allowing this opportunity for us to share this information. And one of the things that I'm really proud of is in seeing this course is that we started this journey with PAHO a long time ago and working on a lot of different projects. And we started with salt reduction. We did this work in the Caribbean, and then we did the work recently in Latin America. And so those, those experiences that we had and all the partners that we have had in those countries who've helped us to develop the content that we're sharing, I'm very thankful to them. But also I'm hopeful that when people are using these courses, they will see kind of the applied aspects of it. It's not just this boring information that you're just getting. It's real. It's something that you can actually take into your workplace right now and do, rather than, I just need to click through these lectures and get the credits. But no, I can do this, and this is helping me to be a better public health professional. And that's what our goal is in really developing this course, is to improve the skills that you already have and build on that. So if we accomplish that, and if we make your work better at your place, then I think we will have been successful. And what I'm really looking forward to also is just hearing feedback from many of the participants to see how is the program going for you, or the course, and what are potential roadblocks that you have. And so I'm very excited about this opportunity, but more excited about looking into the future in terms of the conversations that we're going to have, the collaborations that we will have, to really see the application of this discipline in the Latin America region, as well as globally in other areas. But thank you again to PAHO and the rest of the team here in providing us this forum to be able to disseminate this work that we do at the University of South Florida to a larger audience. Yes.
Thank you very much. So Carlos, Gabriel from the virtual campus, some final comments?
Yes, only Leo, I have see some questions about how to enroll in the course number 2 and to the another course. It's important to say to all, all of you need to pass the course 1, and after you pass the course 1, you will find the form to apply to the next course, yes? Because this, we invite you to go today to the course 1 and develop all the activities of the course 1, and then you find the form to apply to the next courses. Thanks, Leo.
Okay, thank you very much, Gabriel. So, Dr. Hennis, would you like to say a few final words to all the participants? Are you still there, Dr. Hennis? Well, if not, I would like to thank all the panelists and Dr. Hennis as well for their participation in this webinar. As I can see from the chat, it has been very informative. If you have additional questions, you can also you can always contact us. Yes, Maria Alejandra, you have.
Just one last comment. We encourage all the attendees to share this webinar. Tomorrow we will have the webinar in Spanish, so you're all welcome, and also share the invitation with your counterparts. The courses are available also in Spanish, and we record these webinars, so we will share it later with all of you. Thank you.
Thank you very much. That's very useful information. So yes, we invite everyone in 1 hour. It's available on the virtual campus to register to participate in the course, and we hope that many of you will continue with the next courses. We hope in the coming weeks after course 1 to have course 2 and course 3 online, and we are already advancing also in the development of course 4 and 5. So possibly by the end of the year, it's possible to complete the whole program. But also if you only have time for the introductional course, that's also fine. And yes, it's really an effort to build capacity. So I would like to thank our participants, our panelists, and as well the American Heart Association for their support, and the Universal Healthcare Partnership. Also, I've seen that Ruben Grajeda and Nadia Flex are online, and they before I joined HQ PAHO in October, they have also been very supportive and initiating this whole effort, which we have done with the whole team, and our online designer Alejandra Avila. I've also seen her online, so this is really an effort of many people, and I hope it will be of benefit to all of you, and especially we would like to see that through this effort, current campaigns and plans that are being planned are of a better quality, and that they really reach our target audience, and that we can also evaluate and have some good results soon on the reduction of risk factors and other behavioral challenges like the ones related to COVID-19. So with this, I would like to thank you all and hope to see you back all soon as participants in the program. So thank you very much and have a good afternoon.
Thank you.